is Adriana. I'm a nurse diabetes educator over at Sherman Hospital. So I do give classes to outpatients who require help with their diabetes. And I've been a nurse for about 10 years, but at the clinic we also have dietitians in case you want to get more in depth about weight loss or anything with, that has the nutritional factor into it, because my expertise is more on diabetes, carbohydrates, but I know minimum and not as much as a dietitian, and medications and how to test yourself with the glucometer. And I can also help you with the different glucometers that are out there, like the continuous ones. I don't know if you guys have seen people with the little circles on there. Yeah, that's a continuous, and it's really cool too. And we'll talk a little bit about that. I've been with Sherman for about a year doing this, so it's very exciting for me to help people with manage their diabetes, because we get so many with uncontrolled diabetes as well as with prediabetes. So it's so important that if they're diagnosed with prediabetes, to help them prevent them getting diagnosed with the actual diabetes. So one of the things that I wanted to share with you guys first is, I know they look like Frisbees, but they're actually plates, and they're sectioned off. So
Yeah.
you guys this. Cool. And one of the first things that you guys think about when you hear diabetes and controlling your diabetes is food, right? So we have these really cool plates, and they're like pretty normal size. They're not that small. It's like the plate that you would have at home. But here I love it because it's sectioned. So this is in reality how your portion sizes should be. If you have noticed, I know it has the little fruits here on half of the plate, but it's actually supposed to be vegetables. So this whole half of the plate should be covered with vegetables. And I hope you guys like vegetables, because sometimes I get patients that are like, no, I'm not a rabbit, I don't eat vegetables. So you don't have to be a rabbit.
I grow kale.
Oh, that's awesome.
Oh, nice.
Do you make your own kale chips? Those are
Sometimes.
the best. Those are the best. I love them.
My kale crop wasn't terrific this year.
No.
So.
So then, if you divide the other half of the plate and you split it down the middle, so this is in reality what your protein size should be. It's about 3 ounces. So 3 ounces for breakfast. You could have 2 ounces for breakfast, 3 ounces for lunch, and 3 ounces for dinner. Okay, and then the other section is carbohydrates. So, there's a lot of misconceptions. A lot of the patients don't control their carbohydrates very well. And so they split the plate in half, and half is carbohydrates, the other half is protein, and they leave no room for vegetables. So what we teach in our classes also is we encourage people to make vegetables, like not just as a salad, but roasting vegetables in the oven, adding spices, and also sauteing them. So, this is a really cool plate. If you guys can keep this plate, and hopefully you'll use this as a model at home to section off your vegetables and your carbohydrates and your protein. We are going to talk a little bit about our healthy goals. So, with patients with diabetes, we help them set their goals. Diabetes is affected by carbohydrates. So what we teach you in our classes is how to limit your carbohydrates. A lot of the patients don't know what the quantities are. So we break it down specifically in the classes. Okay, so did you know that every vegetable has their own properties, like depending on the color? It's really cool, because a lot of people don't know that. Vegetables supply you with a lot of vitamins and minerals, also fiber, which is very important. So, for example, the blueberries, anything that's blue or red, like dark red. We have the eggplants, blueberries, red onions, blackberries. They are good for reducing the risk of cancer. So every color has its individual properties that it gives to us. Another one is onions. Anything that's white, like the white onion or even the yellow, garlic, cauliflower. That is also very good for your brain function. You know, you were talking about Parkinson's, so maybe, you know, if we eat a lot of this, it'll help us prevent the Parkinson's maybe, you know. I mean, maybe there's like medications that actually have ingredients that are derived from herbs or even, you know, white vegetables, we never know. But anything that's red, like tomatoes, strawberries, red bell peppers, very good for your heart. And it's easy to remember because red, heart, related to the heart. Anything that's green is very good for your bones. Okay, a lot of calcium. A lot of patients are like, well, you know, my potassium's low, so I eat a lot of bananas. But if they have diabetes, it affects them because bananas are very high in sugar. So I do recommend that they have the darker greens, leafy greens, which also have a lot of potassium in them. And then we go to the yellow, like pineapples, the lemons, carrots. I know they're orange, but these colored vegetables are high in vitamin C, which is something that we need right now to, you know, for our immune system. So just keep that in mind, that every vegetable, every color, not only does it make your food look beautiful, if you, you know, if you make a salad and you put so much color in it, not with just the white onion, but these plates are kind of cool, and you know, you're more than welcome to grab these handouts because it's like the Mite Plate Planner. I know you guys may be used to the pyramid, the food pyramid back in the day, but they have changed it. So this is a little bit simpler because we have a plate that just is divided in half, and then half of it we recommend that it's covered with the non-starchy vegetables. And then if you cut the other half in half, that's the portion size for your grains or carbohydrates. And then you have your proteins, which is about 3 ounces. 3 ounces for lunch and dinner, and 2 ounces for breakfast.
Say, what was that again for each meal? Like,
yes.
This is 3 times a day?
3 times a day.
Yeah.
Yes, so you have your well-balanced meal. I know you hear a lot about people saying well-balanced meal. Well, this is a well-balanced meal. A lot of people forget about the vegetables, and they're included in a well-balanced meal. That's what it means. I don't like to call it diet. It's just a well-balanced meal that in reality we should all be eating like this. Half of it with vegetables, which is about 1 cup. And then we have our little section of carbohydrates. And then we have our protein.
I feel like for breakfast, a lot of people don't eat vegetables.
Right, unless they have like a vegetarian omelet,
Right.
which is delicious.
Yeah, that's a good option.
I know that a lot of my patients have brought up like the smoothies or the green juices. Those can also be included with your breakfast. They have it in the morning for some reason, but I don't stop them from drinking it. It's better to have like solid foods, but if they're juicing and having their vegetables in that manner, that's also great. But you still have to have your vegetables for lunch and dinner, even if you do juice. Like
What about
coffee creamers? If you look at certain coffee creamers, they have so many ingredients that you don't even know what they are. So again, with the V8 juice, I haven't really looked at the ingredients because I don't drink it that much. But if it has like, you know, names that you are well aware of, like tomato, celery, onion, and it doesn't have these other weird funky names to it, then it's okay. And I'm glad that you're choosing the low sodium, because what sodium does, salt and sugar are not the best. But what do companies do? They add these because they're cheap and they add a lot of flavor to the foods. So if you take away the salt, you add on the sugar. If you take away the sugar, you add on the salt. So with the salt, it's very important to keep yourself limited, because especially if you have high blood pressure, because the more salt you eat, the higher your blood pressure may go, and you start to swell. So it's very important with like patients that have congestive heart failure, we limit their salt intake because they retain fluid, and then, you know, we don't want them to develop high blood pressure, or if they're on high blood pressure medicine, we want them to avoid the salt. Okay. Okay, so any questions about the plate? I know you guys eat a lot of vegetables, right? you know, at our classes at Sherman, we do give patients different ideas of how to fix their vegetables, how to bake them, saute them, adding different spices such as like garlic powder, onion powder, a little bit of black pepper, and even other spices that people, you know, just store in the cabinet and never take out, like oregano, cumin, just different seasonings like that to add flavor, because I don't want patients to just eat salads all the time, because then you're going to get bored of them. So we want vegetables to be fun, not boring. There are starchy vegetables and there's non-starchy vegetables. So the starchy vegetables are the ones that are going to increase your blood sugar levels.
They're the ones grown under the ground.
Yes. Can you give an example?
Potatoes.
Yes,
carrots.
potatoes. Well, potatoes are a starchy vegetable, so they are considered carbohydrates. So you have to be very careful with that. Carrots, they're a non-starchy, so they're okay to eat.
Okay.
So you can snack on them, you can include them on the half of your plate as a vegetable, a non-starchy vegetable, and that's okay. Another corn. Corn is a starchy vegetable, so I don't like to call it a vegetable. Peas. Sweet peas are also starchy vegetables. So you have to be careful when you go to the frozen aisle and you get the mixed vegetables that have the corn and the sweet peas in them, because you have to count them as a carbohydrate. Can you guys tell me how many carbohydrates you guys can have per meal? No? 3 carbohydrates.
3 items, you mean? Or 3 grams? Or
3
what?
servings of carbohydrates. Yes.
Per day?
Per meal.
Per meal?
Yeah.
Okay.
That's not bad.
So
No.
So servings what?
That's not bad.
Servings what? How many ounces or fourth of a cup? Or
So that's what we teach you when you go to the classes, exactly what the serving sizes are. But for example, like a slice of bread, okay, that's a slice of bread is 1 carbohydrate. So let's say you have toast and eggs in the morning, then you can have three breads, because that would be your 3 carbohydrates. Or you can have a little side of potatoes, which the potatoes are high in carbohydrates, and the size of a carbohydrate would be like half a cup. That's 1 carbohydrate of a potato, and you can have that with 2 slices of toast and then your protein. If you add vegetables to that egg, like a vegetable omelet, way better. Okay, we do recommend, do any of you guys have like the whole grain bread? It's the white bread? You have the white bread?
Whole grain.
Whole grain? Okay. Do you know why you choose that bread?
I like it.
Okay, good.
Whole wheat flour instead of white flour.
Well, I think you said whole grain.
Whole grain
Yeah.
flour.
So that's like that's the bread that you see, and I think brownberry comes to my mind, and you see the little oats on the side of the bread. But what's one of the things that you like about that bread besides the taste?
density of it.
Yep, it's heavier. Why? Because of the fiber. You know, each bread I think has, well, you have to be careful. At the center, we teach you how to read the nutritional labels. So we break it down for you. We help you understand those nutritional labels as far as like how many grams of sugar, how many grams of carbohydrates, how many grams of fiber you should be having. And it's so important because fiber, the more fiber you eat, it reduces your cholesterol levels. Okay, it also keeps you fuller for a longer period of time. So if I have a sandwich just with ham and cheese, that's it, and it's white bread, I'm gonna be hungry in an hour after I eat that sandwich, versus if I have a whole sandwich with whole grain bread that has, let's say, 3 grams of fiber each slice of bread, and I put ham, cheese, cucumbers, spinach, onions, tomato, avocado, that's gonna fill me up for like 3-4 hours. And guess what? It's gonna maintain my blood sugar levels at a stable number. So that's why we encourage that you choose the breads that are high in fiber. There's also, I don't know if you've seen them, they're becoming very popular, the keto breads.
Keto?
Yes, Aldi sells them. You can find them anywhere. Well, that keto bread, it's just, it's a bread that's low in carbohydrates and high in protein and super high in fiber. And it looks like white bread.
There's a bread next to it that I got. It's a lot more reasonable than the keto, but the label is about the same.
Okay. Yeah, as long as you're looking at the labels, and again, we do offer the classes, and this is like so much information to throw at you for in 1 hour, whereas in the classes at Sherman, we do break it down for you. Okay, but carbohydrates are very important for diabetics because those are the ones that are going to elevate your blood sugar levels. Okay, so we get deep into the carbohydrates, the serving sizes for each meal, and you know, the amount of protein and the amount of vegetables that you can have. But a lot of the patients have the hardest time with carbohydrates. Yeah, because especially, you know, if you're a pasta lover, if you're a tortilla lover, if you're a rice lover, very high in sugar. And what I tell my patients is, you know, you can have them, but it's all in moderation. And they're like so relieved because sometimes they say that the doctors, you know, scold them. They're like, you can't have this, you can't have that, you can't, and they get so discouraged. So what we do at the clinic is we say, you know, you can have it, and we teach them how much per meal. But basically it's 3 carbohydrates for breakfast, 3 for lunch, and 3 for dinner, and you are allowed 1 carbohydrate, 1 serving size of carbohydrate in between meals. So you're actually eating 6 times a day. Okay. We do encourage healthy fats instead of the bad fats. Bad fats would be like fried foods, fried chicken, what else? Bacon. I mean, you can have it sometimes, but not all the time. Because what fats do is they keep your blood sugar levels from going down. They keep it up. And what we want as diabetics is to eat, and obviously our blood sugars are gonna go up with the foods, with the carbohydrates that we're eating, but we also want them to go down. And what the fatty foods do is that they prevent the blood sugars from going down as quickly as they should. Okay, very important to know. So stick to your leaner meats. You know, you can have pork, but just have like the pork loin, which is the thinner. Yeah, and I mean, you can treat yourselves to some, you know, fried chicken once in a while, but just keep that in mind. You know, and how much mashed potato are you gonna have with that and biscuit? Come to our classes and we'll let you know.
Are you a dietitian?
No, I'm a nurse.
You're a nurse,
Yes,
okay.
but we do have, it's a good question, we do have dietitians at the clinic too. Yeah, okay. So, another topic that we're gonna talk about is exercise. Okay, there are 3 things that bring those blood sugar levels down and keep diabetics under control. So that's medication, if you're prescribed a medication, whether it be insulin or a pill that you take orally, your carbohydrates that you eat per meal, okay, the well-balanced diet, and exercise. Those 3 things are the ones that are gonna help lower your blood sugar levels, okay? So how many of you guys exercise? That's great. Do you walk outside, or do you have something in your home, like a treadmill?
I hate treadmills. No, I walk outside, or I have access to a couple tracks, the one down at the center and the one at the university, so I can walk indoor.
Okay. You were a little iffy,
Well, I have
but I'll
2
take
dogs.
anything.
I have 2 dogs.
Oh,
So,
okay.
you know, obviously we have to, you know, but they're so slow. They're Pyrenees, I mean, they're huge. And they have to smell everything. So it can take me 20 minutes to walk around the block.
Yes, my dog was pulling that with me today, and I thought I was gonna have to carry him, and he's 90 pounds, so I'm like.
Oh, I wouldn't think that, I'm not carrying these. And you know, and we do have exercise bike, and we have a total gym, and we have a treadmill, and, you know, I don't know.
Oh, wow, that's great.
The center has
Yeah, well, it is
wonderful
great, but I don't-
exercises.
Okay, good. And they have a big track, right, where
Yeah.
you can walk? Yeah, okay. What kind of exercises did you say no?
I try, but
It's hard.
I don't want to.
I roller skate.
Computer
Oh, wow.
almost all the time, so I try to make 2 days kind of half hour of exercise in my house.
Okay. You know that there are also exercises on YouTube?
Lots.
Like if you don't have the money to buy, to buy a membership at the gym, or it's simply like the weather outside is just bad, or there's some people that just don't like to exercise in public, and that's understandable. You can do this at the privacy of your own home with YouTube.
Library has
there's a lot,
excellent videos, and
There's a lot of
Walking
stuff.
Home, Leslie Sansone is very good.
Oh, yeah, I have a lot of her
Yeah.
tapes.
There's also chair exercises, which you would think that are not gonna challenge you, but I've done these chair exercises and they are pretty strenuous. And every one of us has a chair, I hope, at home. So you can just bring the chair, and if you wanna be more challenging, for your arms or your legs, you can put weights on them. You can use bottles of water or a can of beans, just don't drop it on your feet. But you can use those, and there's a variety of chair exercises on YouTube. Okay? What kind of exercise do you do?
My excuse is I'm having meniscus surgery on Friday.
Okay,
So-
that's a very good excuse.
Yeah.
Pretty much
Yeah.
an excuse. I'm
Chair
learning to-
exercises.
Yeah,
There
chair,
you go.
thank you, chair. I'm actually enrolled in the Silver Sneakers thing,
Yeah.
and they have tons of stuff to do too, so I've been.
All that
seeing-
online stuff,
Yeah,
yeah?
yeah.
Do you like it?
I've done just a few, but
Yeah.
but they offer so many.
Oh, wow.
I can't even keep
I
up.
looked at them, but I won't go in the gym. Honestly, God, those men there make more noise than I did giving birth. I mean, seriously, I've given birth twice and never made that amount of noise.
Well,
Oh,
when you
Jenna.
join center size, the center here has a room that nobody sees, it's just women.
Yeah,
It's women
I've seen
only.
it, yeah, I've seen, I don't know. I'm just-
Is that with Danae?
I'm not,
Danae
Well,
at the
that's
center?
private, but
Oh.
Danae has senior fit and chair yoga.
Yeah, she's real good. She's gonna teach a class at the library in February.
She's
which
got
would be
COVID
good.
right now.
Oh, I'm sorry.
Danae,
Oh.
she's an excellent teacher at the center, and she does a lot online too.
And I think they have like the whirlpools at the center too, right? For
Well, they have the
women and-
therapeutic pool
Oh,
for
okay.
hydrotherapy, yeah.
Yeah, my dad loves that pool.
Exercises, yeah.
Okay, all right, so exercise is a big deal for diabetics, okay? Remember 3 things: medication, carbohydrate control, and exercise. There are some patients that are not on any medication. The doctor tells them, you know what, I'm gonna give you a chance with diet and exercise, so this is the way to do it, okay? So with diabetes, do you guys know what a hemoglobin A1C is? It's a blood test. Do we
See,
have it?
that's changed since I was in hospital nursing.
Okay.
So I don't really know how to evaluate that,
So-
I know what an AC1, your number matters,
Mhm,
kind of
yes.
how you're doing overall.
Yes, so your hemoglobin A1C is a blood test that you have to get tested every 3 months to let you know if your diabetes is under control or out of control. The hemoglobin A1C lets us know what your blood sugar levels have been for 3 months.
Oh, yeah.
Okay, so that's why it's very important that.
I just took that last week.
Okay, good. Does your doctor test you about every 3 months? Or if you're well controlled, they wait 6 months. Yeah. So do you know what a well controlled hemoglobin A1C is for a diabetic?
No.
7.0 and below that.
That's a good reading.
Yes, 7.0 and below that is a well controlled hemoglobin A1C for a diabetic. Okay, so what happens if you're not well controlled? What starts getting affected in your body?
Your nerves, a lot of things.
Your nerves, yep.
The important thing is to keep your blood level as level as possible.
Basically, diabetes or high blood sugar levels affect every part of your body where the blood flows. Pretty sad, huh? Because it flows everywhere. Okay, so very important to know what your hemoglobin A1C is. If the doctor doesn't tell you, ask them. And again, we want it to be 7.0 and below that. Because if it's above 7.0, that means it's starting to affect your body on the inside. Okay, so we want it to be as low as possible. Or, you know, there's patients that come to me with a hemoglobin A1C of 13. And you know, we work with them, and of course they are on medications at that point, and they manage to get down to like below 7.0. But they have to work very hard for it, because it's hard to lower your A1C, but it's very easy to increase it.
Does this go for type 1 and 2?
Yes. Yep. So again, with your A1C levels, or with a new diagnosis or a diagnosis of diabetes in general, it's very important to get your eyes examined every year, okay? Because again, high blood sugar levels or diabetes affects everywhere where the blood flows, and it's very important to get your regular eye exams, because with patients that are uncontrolled with their diabetes, they start having blurry vision, and then thankfully, once they bring that hemoglobin A1C down to a controlled level, they start seeing better. So that's good, but the nerve damage is the one that's irreversible, okay? And when you go to visit your doctor, I don't know if they've done the exam, the foot exam, where they run something sharp on your feet to make sure that you still have that sensation. They're supposed to. They're supposed to do that test. Have they done it? Yeah. So what do? They run a sharp object on your feet?
Yeah, just to see
If you can feel it.
Yeah.
I mean, they don't stab you, but they want to make sure that you still have that sensation there. So what happens if you don't? That means that there's nerve damage. Okay, so it's very important for you guys to get, or diabetics in general, to get your feet examined by your doctor. It's usually every 6 months or sometimes once a year. Okay, because there can be nerve damage done, especially if the diabetics have been uncontrolled. And you know, very important to wear comfortable shoes, because once you lose that sensation in your feet, you can have like a little injury and not even feel it. And guess what? If your blood sugar levels run high, bacteria love dark, moist, sugary places. So it's going to be very difficult to heal. Okay, so very important for you to check your feet, get your eyes examined, and what's another very important part of your body that you use every day? You're using it right now, your teeth. So very important to get your dental exam as well. Okay, and then there's other tests, like for women, mammograms, and for all of us that have a colonoscopies. Okay, they've decreased the age to 45. I remember 5 or 6 years ago it used to be 50. Now it's 45, probably because of so much colon cancer.
Does that new test that they're advertising on TV work, where you can send something in and get
The stool sample,
I
or
think so,
it's not as accurate as the colonoscopy.
There's no substitute for a colonoscopy.
Yeah,
Darn.
I think they're starting to, and I'm pretty sure in the future it's going to be something that's going to be more popular than the colonoscopy. Is you have to swallow like a little pill that has a camera inside.
Oh.
Yeah, and it goes down. I think it passes through your digestive system in 3 days, and then whoop, comes back out. You guys can use your imagination how.
Yeah, I had one in July, and I was talking to the nurses that, you know, just afterwards, and I said, you know, the test itself is nothing. I mean, you know, it's a nice name, so you know, but it's the prep, that drinking that.
Yeah.
She said, she thinks within a year they're going to be doing away with that,
Mm-hmm.
and I don't have to go back for 5 years. So I'm like, good, work on that. Work real
Speed
hard
it
on
up.
that. You
Speed
got
it
5
up.
years, and you know, let's get it done.
Yeah.
That's the worth. The prep is awful.
Absolutely.
Yeah, that
Absolutely
nap, I said,
awful.
can you come by at about 10 o'clock every
Well,
night?
yeah, you know, they gave me afterwards, and I still have my eyes
Yeah,
closed.
my
They're like,
husband too.
"Are
He
you
says it's the
okay?"
best sleep I've ever had.
It does. You wake up and you're like, whoa,
Ooh,
great.
refreshed. Where's my cookie and juice?
Okay. Do you guys have any questions about the testing? You know, if for women, if you get diagnosed with having dense breasts, which is very popular now, you can have an ultrasound just to back up that that mammogram, because a lot of the times the mammogram can miss the masses if you have high density in your breasts. So it's something that you
And
can
men
also
have breast
request.
cancer also.
I'm sorry?
Men can have breast cancer
Yes.
also.
Yep. So when we have our classes at the hospital, we encourage that you bring your family in, because it's very important to work on your diabetes as a whole family. It doesn't do you any good if you have a husband who is not gonna work with you on eating any kind of vegetable. I mean, it's very hard to cook for like 3 people, 3 different meals. Let's say you have children. You have a husband, which is another child. I'm just kidding. And then you have yourself. So it's hard work. So what we do is we encourage you to bring in your family so we can work with the family as a whole. You know, it's not gonna do me any good if I have diabetes and I have a husband who brings in the 24 packs from Sam's of Coke. It's not gonna be good, because what am I gonna go for? You see the item and you're gonna want it. So it's very important for you to work as a family, to go grocery shopping as a family, and it's very important for you to not go to the grocery store when you're hungry, because you're gonna go for all the sweet foods, and that's not,
Chips.
yes. Potato chips, yes.
Or don't send your kids to the grocery store with their dad.
Yeah.
Junk food.
Yep, junk food. And you know, the marketing team at the grocery stores,
Okay.
they know what they're doing. They put all like
The
the
milk is in
not
the
so,
bag.
yes. So at the hospital, there's a lot of patients that are on antibiotics, especially IV antibiotics, and it's very important that they get their probiotics in, because then they develop diarrhea. And then when they develop diarrhea, we get very scared, and then we start testing for C. diff. We ask you for the stool and everything. So it's not just for children, but it's also for adults on antibiotics.
Right.
Yes. But when you think of probiotics, what do you think about? What gives us the probiotics that are not in pill form?
Yogurt.
Yogurt. So you have to be very careful on the yogurts that you choose, because they load them up with sugar. So that, you know, sugar is not very good for your gut health either. So you have to pick the yogurt that has the least amount of sugar, and that's the best one. There's you have to really read the nutritional facts, because there's different brands of yogurts, like I think it's like Life and Fit or something like that. There's even something with, bless you, that says Weight Watchers on there, but it has a lot of sugar, so you really have to compare the yogurts and make sure that the less sugar, that's the yogurt for you, the better.
I go with the plain Greek yogurt, full fat, and then I put in a little lemon curd, just it has a little sweet, it gives it a lemon flavor, and then like fresh berries.
Oh, that sounds good. But for people, and I'm gonna try that though, I'm speaking from experience, the Greek unflavored yogurt for me is very sour. I can't handle it. So there's another yogurt that we recommend. It's called Too Good. Too Good yogurt. They have the drinkable, and they have one that you can eat, you know, the thicker one. This one has 2 grams of sugar, 2 grams per container, and the drinkable one.
Who carries it?
It's everywhere.
Oh,
Yeah, it's Too Good, TWO, and then Good. You can find it at Walmart, Meijer,
I haven't seen it.
Woodman's, yeah.
Yeah,
So,
that's excellent.
and it's sweetened with stevia, which is plant-based. So, you know, it has a lot of flavor. You know, try it out if you get a chance. Okay. Do you guys have any questions about the hemoglobin A1C, about the testing, carbohydrates?
Is it a fasting test? Is it a fasting?
No, it's not a fasting test, no. Do you guys test your blood sugar levels with a glucometer?
I have one. I have done it. I should probably do it more.
Okay. Do you know what your levels should be?
I did. I know that.
180
So I have a form here, and you guys are more than welcome to take it. So the fasting blood sugar levels for a diabetic, fasting means in the morning when you haven't had anything to eat or drink, they should be less than 130 for a controlled blood sugar level. And this is only for diabetics. 2 hours after meals, they should be between 70 and 180 or below 180. And that's a controlled blood sugar level, 2 hours after meal. Now, I used to think that I had to test after I finished eating the meal. It's at the beginning of the meal, 2 hours after that is when you should test. So if the first bite goes into your mouth at 7 o'clock in the morning, you have to test at night. So just to clarify, because I used to think that it was at the end of the meal and it's at the beginning.
You always AC, yeah.
Mm-hmm. So again, feel free to test. And it's very important as diabetics that you test your blood sugar levels. Because what I tell my patients is having diabetes and not testing your blood sugar levels, it's like driving a car with your eyes blindfolded. You don't know which direction you're going. Okay, and one of these, it's very important that you test, because that's how you know how the foods that you're eating affect you. Okay, like let's say you had 4 slices of pizza. You tested 2 hours after that. Your blood sugar levels were 240. What are you gonna do next time? Eat your 4 slices of pizza again? No, you're gonna maybe cut it down to 2 slices and then add a beautiful, colorful salad with it, right? Don't look so sad. You can still have your pizza.
Oh, vegetables
Yeah.
are great. They've gotten a bad rap.
Yeah. Vegetables are so important for us. They provide us with vitamins, minerals, and fiber. Okay.
Do you have any favorite recipes for veggies that you do all the time or that you recommend to your patients?
Yes, I love roasting vegetables because you can have a variety, and I love all vegetables. So what I do is I cut up a variety of vegetables, and then I put them in a sheet pan. I spray them with olive oil, and then I put a whole bunch of spices on there. I put oregano. My favorite is the Italian mix, because it has a lot of herbs and spices inside that mix, and it doesn't have salt. I like to add my own salt because I have control of how much salt I like to eat. And I like spicy, so what I do is I also like to put the crushed pepper on it. Yeah. And then I put it in the oven at 400 degrees for 25 minutes or until they get a little brown and toasty. And then I meal prep. I put them in glass containers, and I just take them to work and microwave them and eat them. Yeah.
That sounds yummy.
Yep. I bought beets from Costco, the organic beets, and they're already cooked. They're boiled, and they're whole beets. I've never seen those before. Usually you get the canned beets that are sliced up. So I started making. I cut up the beets and I put cucumbers, onion, jalapeno peppers. What else did I put? I think that's it. And I put olive oil and balsamic vinegar. Yeah, with a little bit of salt and pepper. And they're so good. So important. Nutrition is so important, and that's something that we're not taught at school. I mean, as a nurse. Did you say you were a nurse too?
Yeah.
So I only had 1 class of nutrition. That's it.
All I
Did you
remember
guys
is
have any classes?
Legumes. I go, what's a legume? It's anything in a pot.
Yeah.
I remember,
I don't
every time
think-
a nutritionist got up there, she'd say, eat greens and legumes.
Yeah, it's so
Yeah,
important.
yeah,
I wish
long time
we
ago.
would have had more classes in nutrition and the breakdown and the ingredients of the food, because when you're working nights in the hospital as a nurse, you eat horribly. And that's something that I didn't know until I started working with a dietitian, and she taught me everything there was to know about food.
Yeah.
And I am so grateful, because I'm not just following what she taught me, but I'm also teaching it to my family too.
Right.
So it's awesome. It's how you can spread this education, and this is what we do in our classes.
Well,
But you
and
know what? Once you find a good product, guess what? The next time you go to the store, you're just gonna grab it right away, and
Right.
it's much faster. Yep. So,
Would you talk real briefly, Adriana, about signs and symptoms of diabetes, like just recognize them
yes.
initially?
Thank you so much. That's so important. So, signs and symptoms of diabetes would be feeling excessive thirst. Yeah, and then having to urinate like every 30 minutes. Okay, some patients it's scary because they can go up to the 400s in blood sugar levels and they don't feel anything. So a high blood sugar level, you start feeling, some patients, it's not the same for everybody, but you start feeling like nauseated, you start vomiting, shaky, and it's similar for low blood sugar levels because you start sweating. Patients get confused if you go below 70 or sometimes lower than 70. I've had patients that have been in their 30s blood sugar levels and they're like drenched in sweat. You ask them questions, they don't know, they don't respond. So that's when it gets scary. So it's very important that if you're taking insulin, always know your blood sugar level before you inject that insulin and always have a meal. Because the medications for diabetes, they're meant to lower your blood sugar levels. So you're supposed to eat a well-balanced meal to keep that blood sugar level at the number that it should be at a controlled rate. Okay, and that's why it's so important for you to test.
That's what the pumps do for you, don't they? Keep a record of what your blood sugar level is and how much insulin you need.
The insulin pumps, yeah.
Yeah.
You can plug in the amount of carbohydrates that you ate, and then it gives you your insulin. Yeah. But with the glucometer, depending on how many times your doctor asks you to test, it's either twice a day, 3 times a day, once a day. It just depends on what your doctors ask you to do. The very important one is the fasting blood sugar level. Now, a lot of patients don't know that. A lot of people don't know that they're pre-diabetic. But what do we have done every year? We're supposed to go in for a physical, right? The doctor orders a blood test. This includes cholesterol, your electrolytes, your blood count. Well, in that test, fasting blood sugar. So you're supposed to look at and now the hospitals have the apps where you can look at your lab tests, the results. So that's nice. So I want you guys to look at your glucose level because you go in fasting. So for a non-diabetic, it's supposed to be less than 100. Once it starts creeping up over 100, the fasting blood sugar level, that means something's going on. You're having some kind of insulin resistance in your body and you should get your hemoglobin A1C checked. So for a person that does not have diabetes, their hemoglobin A1C should be 5.5 or below that.
Their what should be?
Hemoglobin A1C, 5.5, yes. Once it starts creeping up, that means you're getting classified as pre-diabetic. Once you hit that 6.4, you are diagnosed with diabetes. Now, once you're diagnosed with diabetes, you're gonna have it for the rest of your life. It's just having it controlled or uncontrolled. Okay, very important information. And a lot of people don't know. So, you get tested for your blood tests, your physical every year, and the doctor may say, you gotta be careful, you're in the pre-diabetic range, and they're like, whatever, I still have time. So then they start eating and then they get diagnosed with diabetes. And it's too late.
But they don't usually include a A1C, do they, for a routine blood test?
No,
No.
no, but the glucose is always
Yeah,
there.
but my FBC, I just
Yes.
had it done a week ago
Yes.
Friday.
Yeah. And another test that is very important because we don't have sun, we don't have enough sun in Illinois, is your vitamin D. Now, when you have a low level of vitamin D, you feel tired all the time. And guess what? You need sweets or sugar every day. You can't live without it. It's like something that you have to have. So it's very important that if you guys know this, or if you guys know somebody who's feeling like this, for women too, they have a lot of hair loss. Very important to ask your doctor for a vitamin D level, and it's a blood test.
And I got, my doctor told me where I could get one done for like $50, because unless you have that diagnosis, you know, the insurance isn't gonna cover it.
Yes, thank you for bringing that up. A lot of the doctors won't do that test because the insurance won't cover it.
But
So you have to ask for it.
Okay.
And they tell you, well, it may not be covered, and you're supposed to say, that's okay, I still want it, because I think it's like $50 to $60, the test. Some insurances will cover it, some won't. And it's a quick fix, because all you need to do is take vitamin D3. And there's a lot of people with vitamin D deficiency. And they're like sleeping all the time. They're like, why am I feeling so tired? Why do I have to eat candy or sweets every day? And I'm telling you this as, what are the hair things? I'm not just a client, I'm also a person who experienced it. I forgot, it was a long time ago, that commercial. But yeah, I needed to have Culver's frozen yogurt every day. And I'm like, something's not right here. Something's not right. So I went to get my
It goes
vitamin
along
D
with
checked.
depression too. I mean,
Yes.
the hunger for carbohydrates,
Yes.
the lack of sunshine, the lack of vitamin
Yep.
D.
Yep. So now that we're not getting enough sun, it's like, so get your vitamin D checked. And if you know anybody that feels like that, have them ask for it. This is very important, because once you start getting vitamin D in your body, that craving goes away. Okay.
How do people get involved in your classes?
So it starts with your primary care doctor. So please take a handout, and for anybody that needs it, that you know that has diabetes and needs help, or even if you have diabetes and are well controlled, I mean, the information that we teach you in these classes, you can pass on to other people, and you know, have a better awareness of what diabetes is about. You start with your medical doctor, and what you need is a referral for either a dietitian or diabetes education. And a lot of the doctors will say, okay, you know, you have diabetes, the diabetes diagnosis, I'll give you a referral. And then you call this number and you say, I have a referral, and you're good for about 8 classes, 8 hours. You don't have to come to all the 8 classes. Some patients are good with just 2, 3, some with just 1. They're like, I got this, I'm well controlled, they lower their A1C, good. So, but it covers for about 8 classes. Depends on the insurance, yes. But you do need a referral.
Okay.
Some of the doctors send us the referral straight. You know, you have the appointment with your doctor, and your hemoglobin's not under control, so the doctor's like, I'm gonna send a referral to the hospital for the dietitian or the nurse educator to give you a call, make an appointment.
Okay. That's almost like having a coach that's helping you sort
Yes.
of work through it, right?
Yep, yep. And the knowledge that you gain from it, I mean, a lot of people don't know what an A1C is. A lot of people don't know what to look for. A lot of people don't know how to count their carbohydrates, and this is what we teach you in these classes. So for the continuous glucose monitors that are out there, which is the Dexcom, it's the ones that, you know, you put behind your arm, the little sensors, and it automatically sends your blood sugar levels to your phone or an app. To qualify, depends on the insurance. Sometimes you have to fight for it with your insurance, but you have to be on insulin, have diabetes and be on insulin. And then you can request the continuous glucose monitor from your physician. Okay. And,
That's good
yeah.
to know.
Yeah. And it's, you know, for those patients who don't like pricking themselves with a needle 4 times or 2 times or even 3 times, you know, one time they're terrified of needles like myself, that is a very cool device
Yeah, good.
to have. But with the continuous glucometers, they do have alarms. So if you're dropping, if your blood sugar is dropping, it alarms you on your phone. And if it goes up too high, it also alarms you. So that's a good
There's
thing.
an app for that.
Yes.
There's an app for that, great technology. It keeps changing,
Yeah.
keeps getting better, more helpful.
Yes, yes.
Well, Adriana, thank you so much. We
Oh,
really
thank you.
appreciate
Thank you for coming.
Great